So at 24 is when I was diagnosed, but about 23 is when I started to kind of feel a little change and stuff, not in the size or anything, but every now and then it would be sore. And there were times that, I could, if I was sore, so I rubbed it or whatnot, and if I put too much pressure on it, I did get a discharge, a yellow, like orangish discharge. That at some point, if I squeeze it too much, it turned red, so it looked bloody, I guess.
Right.
I was like, thinking to myself, that's probably not the best thing. It's probably not right, but
Right.
just like any other male, sometimes we're just like, oh, it'll go away.
Right.
I don't want to feel like going to the doctor, all that stuff. But eventually, I went to go get a new physical, or a routine physical, good health insurance through my job and everything, and went through the physical. Doctor said, "You're all good. Anything for me?" And then I mentioned the lump, and he turns right around and goes, "Hey, go to this place and go get a few scans. Go get an ultrasound." And so I went to the place and stuff, and then they told me, "No, you're in the wrong place. You got to go to the other building right behind it." And it ended up being the women's clinic. And so, that is definitely an eye-opener, awkward situation to walk into the women's clinic, as a male walking in there. You see a few other males there, but they're there with their wife.
Right.
Sitting, in the chair right next to them. And
okay. Well, listen, again, let me interrupt you for just 1 second, because as you progress with this thing, the really important thing that you talked about was a discharge from your nipple. All right. Now that we do not see with enlargement of the male breast from hormone imbalance or marijuana or whatever the reason is. So the nipple discharge was clearly abnormal. And you also described it as sort of being reddish, if you will, and that was indeed very abnormal. So the next doctor that you saw, who said get a mammogram and an ultrasound, and I'm sure they probably are going to tell us they did a needle biopsy after that. That doctor, congratulations, because that doctor was spot on, okay? Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.